The doctor sent me home with an infected wound, and I am a diabetic. Anyway, I pack my stuff, I call my kids, and I leave. That is the Monday. The Tuesday, it have this gentleman, this decent gentleman. He called me. He said, Miss Richards, what are they telling you at the hospital? I said, they're not telling me anything. I am home. He said, what? Why you home? I said, well, because I asked them for the X-ray. They refused from telling me. So, because they didn't tell me, and I asked them again, they decided to send me home. I could have been a dead person today, and I would have been dead. That gentleman decided he's going to take it on his own, and then he went, and he talked with the doctor, and he get me back to the hospital, and I know what the X-ray state, and then I had to remove my leg. I sit down here, and I am saying the treatment that met out to me at the hospital, it was not good at all. I was to use some medication after I lose this foot. And the doctor told me the medication is to prevent the clot from going to my heart. $30 for one of the injections. I bought the injection and I could not get them because they take the injection and then, you understand? So I am saying the treatment that we get in our health system here is no good. It is no good. I sit down with pain. I had to remove my foot that cut from down here. I had to remove it. And they had to carry it up here because the gangrene started to travel. Nothing but the truth I speak in here. I meet it rough at the hospital. And here now, I nearly forget this part. At one point in time, when I went back to the hospital, right? And the doctor looked at me. I told the doctor, say, oh, you come back, we have to think. I said, he's here where he tell me. He said, oh, you have friend in high places. I said, I have friend all around. I have friend in high places, low places, and anyhow, I have to meet them. This is not the way you treat people. I had it hard in the hospital because I use a word and say, my God is in control. They spite me for that, and they send me home with an infected wound. This caused me today to lose my leg. I am home, I'm not working. I have a little business. I just had to have it there. 5 years closed down, didn't do nothing. I'm not working. And there's a lot of things going on in the medical system and nobody is speaking up. But I sit down here and I intend not to speak up. And I am glad for this opportunity because I speak nothing but the truth. The health system is no good in the hospital, no good whatsoever. I want a new government to take the medical system very serious. Real serious, because I know right now it is not in a good condition. It ain't fit for us. Because in going down there is like you just have to make up your mind. Especially as a poor person, you don't have money to buy medication, it ain't easy.
Gonna break these chains around me.
It is not easy. Yeah, so I here to tell my story and nothing but the truth. It was real painful for me. And I just, as a diabetic, I just try my very best not to make nothing happen to me to go down there because it ain't easy. The medical system is no good. Nothing going on.
These tears will all be drying. Soon these eyes will see the sun. Might take time, but I'll see it.
A very dissatisfactory situation we're living in now in terms of healthcare in St Vincent and the Grenadines. And we must do something about it.